How to test for gout. If you have experienced severe pain and high levels of inflammation in one joint and you have no known injuries or medical conditions that could cause such pain, you may want to be tested for gout. 1. Gout happens when too many uric acid crystals form around a joint, causing pain. 2. Most patients with gout experience pain in the joint of the big toe first, but any joint can be affected. 3. To test for gout, your doctor will most likely use a joint needle aspirate test or a blood or urine test. 4. Preparing for an appointment with the doctor. Complete a medical history. Medical conditions such as diabetes, high blood pressure if left untreated, and problems with your heart or kidneys can leave you more susceptible to gout. Similarly, treatments for certain cancers can cause gout, such as leukemia and lymphoma. 6. Also, make sure you note any severe illnesses, infections, or trauma you've had, especially if they occurred recently. 7. Find out if you have a history of gout in your family. If so, you may be genetically predisposed to the condition. Ask your parents if they know if anyone in the family has had gout. Have a list of your medications ready. For example, loop or thiazide diuretics and low-dose aspirin can both contribute to your risk for gout. 11. Make note of your symptoms. Jot down when you are having pain, such as twice daily or only in the evenings. Also, write down where you are having pain, such as your knees or your big toe. Note any other symptoms you may be having, such as redness, swelling, and limited range of motion or tenderness in certain joints. Keep a food diary. A food diary is a list of the foods you eat in a day and an approximation of how much of them you eat. For instance, you could write down that you ate 6 ounces of steak for dinner, along with 1/2 a cup of broccoli, and 1/2 cup of mashed potatoes with 1/2 a tablespoon of butter. A food diary could be important when diagnosing gout because you can be at a higher risk for gout if you consume large amounts of meat, alcohol, or high fructose foods. 14. Jot down any questions you have. For instance, maybe you want to know if the pain could be caused by another type of arthritis. Similarly, you may have a question about a medication causing joint pain. Write those questions down so you don't forget them when you talk to your doctor.